right now. All right. Hello, everybody. It is the 23rd of May, and uh, we're going to do our Zoom call for the night. So this is a nice slide. I like this. Change your mind and change your life. Well, there's a lot of truth to that. It's not a perfect truism, but it does make a lot of sense. What we think about, what we put our mind to, and what we allow in our mind um, does affect our life tremendously. So it doesn't mean that we can just change our mind and we're not going to have cancer anymore and it's instantly disappeared. We don't have headaches anymore and our headaches are gone, or anything esoteric like that. But we do have to decide, and it's probably maybe the only thing that you have complete control of in your life is what you put your mind on. And so I would highly recommend that you try to put your mind on things above, your blessings, your gratefulness of everything that you have in life and everything that exists. And the greatest of that, hopefully, is your relationship with your Savior. And there's a lot to be thankful for. So with that, we're going to jump into the questions. We got some heavy ones here. This is not quite the heaviest one, but it gets deeper. I went to the chiropractor for an adjustment, as you said, because I do believe in chiropractic care. And my C3, that's your third cervical vertebrae in your neck, was out. Now he has me coming back every 3 to 4 days. I am truly hived out around C3 to C1 to C3. I don't know what that means completely. Maybe they have a rash. Maybe they feel irritated around that area. Along with T5. My immune system doesn't like the applicator tips. I'm assuming that's the tips that the chiropractor is using for adjustments. I'm not positive. The chiropractor suspects neuropathy. How do you determine if all the treatments they suggest are necessary? I told him I need a break to let the sore inflamed areas settle down a little bit. Do you have any suggestions if any of the Rife or Sequix programs will help? A lot of questions there. So number one, if you have some inflammation, definitely do the Rife programs. I would do accelerated healing on the Rife. Do any of your sequence programs would be helpful for this. So I would say absolutely. If you have inflammation there due to what the chiropractor is doing, I would honestly suggest maybe looking at a different chiropractor, possibly. Yes, I do believe that when you start making changes to your spine, and there might even be good changes, adjustments, that it could be more sore to begin with than in order to heal. And getting back to the first question, how he has me coming back every 3 to 4 days. How do I know if that's too much? How do I know? Well, that's a tough decision. So a lot of chiropractors practice different ways. That's the pro and con of chiropractic. There's some that practice on a basis of what's called straight chiropractic, and they just believe in the chiropractic philosophy of getting adjusted on a regular basis is good for you. I tend to fall into that category. There's other chiropractors that practice corrective chiropractic, and there's a time that I practice that way. And those are the people that are taking x-rays, very specific x-rays, and then they're working along the process of changing those x-rays and being able to take after x-rays to show that there's a change in that, in what they've done. So I don't believe that's the chiropractor you went to. I believe that the way it sounds, though you worded this question, they don't have any objective data that is proving that you need to come back or not. They're just saying that this is really out. They've palpated that and you need to come back. If what he or she is doing isn't making you feel better, then maybe that's not the place to go. And again, I know that sometimes when you first start getting adjusted, it doesn't feel better to begin with, but after a number of treatments, you better improve, your symptoms better improve, or you want to go to somebody who is maybe more specific in their technique. Well, I never want to bash another doctor or say anything ill about another doctor. I think it is wise to to make sure that you're getting the best care that you possibly can. If you don't feel like you're getting good care from me, you should confront me about that as well, just like you should confront any doctor. Question came through in the chat. Are you okay with getting x-rays at a chiropractor? I would say yes, I would be okay with getting x-rays. Matter of fact, one x-ray of the cervical, AP and lateral x-ray, that's 2 x-rays of your cervical spine. In my mind, that would be extremely wise, because you got somebody that's adjusting your spine. I used to take x-rays when I did chiropractic, and many times I found things on an x-ray that made me not want to adjust their spine. One time there was a fracture of a vertebrae that I picked up on the x-ray, and if I would have adjusted that person, you could have injured that person severely. So especially if you have a history of cancer, you should be going to a chiropractor that's either adjusting you with a very low force technique where there is absolutely no possible fracture that could be ensued in that type of technique, or they better take an x-ray of your spine to make sure that you don't have any, God forbid, metastasis to your spine, and that's what's causing the pain there, and then they adjust it and they actually fracture the vertebrae. So yes, I think it is a very good idea to take an x-ray given any cancer history. There's no way when I practice chiropractic that I would take on a cancer patient for chiropractic care without seeing a full set of x-rays so that I make sure that they don't have metastasis. That's just downright dangerous. So you should have that. Now, if they're just doing an activator technique or something like that, you could still hurt somebody with that. So you got to be really careful. Next question. Upon reading some of the Rife programs, I ran across adenovirus, conjunctivitis, and canker sores. It stated that cold sores or canker sores are one of the main causes of Alzheimer's. Is that true? I would say there isn't evidence that that's true, but there is a belief that Alzheimer's can be, herpes viruses can be a contributor to some Alzheimer's events. But I would not say it's a main cause of Alzheimer's. It's said to alkalize the body. Use L-lysine, vitamin D, and curcumin, which latch onto plaque formation. So alkalizing the body is important because remember we had a Zoom call a few weeks or months back that spoke about cold sores and what cold sores are. Cold sores are herpes virus that lives in the nerve ganglion. So a nerve ganglion is a nerve bundle. So if you have cold sores in your mouth, it's usually in the trigeminal ganglion that's up in your upper cheek. And it lives there, and it's really hard to kill. Even if you ran the herpes program all the time with the Rife, you're never going to completely kill the herpes virus. It's probably going to be with you the rest of your life. And it comes out when there's a change in pH. So that's why when you lay in the sun for the first time, that changes the pH in your mouth, and you could get cold sores. Or you suck on a lemon, that's very acidic. It changes the pH of your mouth, and you could get cold sores. Well, did the lemon cause the cold sores? Did the sun cause the cold sores? Am I allergic to the sun? Do I have an allergy to lemons or limes? No, you don't. It's just the pH change in the saliva that allowed the opportunistic organism, the herpes virus, to travel down the nerve and to expose itself with an inflammatory pustule on your lip. So changing help alkalize the mouth, and I said in that previous Zoom call, by even taking a calcium tablet, licking it, and dabbing the calcium tablet on the herpes cold sore can be helpful. So chewing up a calcium tablet, how gross that might be, and it tastes like chalk, but that can help instantly change the pH of the mouth through the mineral content in there, or any other mineral will help with that too. Lysine is a good amino acid for decreasing cold sores, especially people who have chronic cold sores, and vitamin D is very important too because that helps the absorption and cell function of calcium and helps with mineralization. So that's really good too. You can certainly follow the rest of the instructions on this, as well as running the herpes programs and stuff. The other part of this person's questions was, upon awaking is when I get small blisters appear on the inside of my mouth. Is it possible I become more acidic overnight? Yes, it is very possible. And one thing that might help that is literally opening up one of your mineral capsules, dumping it in a little cup, and dabbing your finger, wetting your finger, dabbing it in there, and just kind of sucking on that a little bit, especially before you go to bed, to help decrease the or increase the pH of your mouth before you go to bed, so that might prevent that. Next question. Was referring to some video that this person watched. This doctor on the video said something about loading up with antioxidants while doing chemotherapy so that the chemo will target more of the cancer cell and the antioxidants will protect the healthy cells. So I know you recommend water fast, but I wonder what you think about that. It seems to make sense to me to load up with antioxidants right before chemo, like doing a berry smoothie or something like that. That's a very good question. But here's why it's a really good question. So I put together a couple pictures that I just pulled off the internet a couple minutes ago. And to understand the answer to this question, you have to understand a few things about what chemotherapy is doing to a person's body purposely. So first of all, we have to understand how cells die. So here's a healthy cell, nice happy cell here, smiling, big mouth open there. These are actually parts of the cell. But a cell dies through three main processes. One is normal programmed cell death. That's called apoptosis. That's what's not taking place with a cancer cell. So normally cells are supposed to live a certain period of time. And then on the outside of the cell membranes, things attached to it stimulate a process that goes inside the cell that stimulates this normal programmed cell death, this apoptosis. These particles of the cell break off and the cell gets partially really recycled. So that's a normal program that takes place in the cell when that cell is ready to die. Cell death is actually a beautiful thing, and your body reuses a lot of parts of that cell. And there is, in this process, there is no waste, there's no Herxheimer reaction by the patient. You're not toxifying your body with cell particles because your body is reusing these pieces and it's cleaning it all up. The other type of cell death is called autophagy, and we've spoken a lot about autophagy, we've spoken a lot about apoptosis, and this is how your body cleans up things in the cell, inside the cell itself and the cells themselves. It cleans things up. This is how you clean up dead tissue. The third type of cell death is an abnormal type of cell death. It's called necrosis. Necrosis is when when cells die due to being poisoned. So if you consumed a deadly toxin and you died from that deadly toxin, it was because too many cells went through necrosis and that's what killed you. So the deadly toxin caused necrosis or lysis of the cells. So a necrotic cell dies through the process of lysis. So cell lysis is when the cell literally explodes due to a toxin and it can make you sick. So for instance, a necrotic process that doesn't kill you could be, let's say I cut my skin really bad and I wound up and it forms a scar and a wound, and then that wound falls off right after a period of time. That's necrotic tissue. It died through cell lysis, through an abnormal, not through apoptosis, not through autophagy, but through lysis. Another example would be, I got strep throat and my throat is super sore and I'm coughing and I had this really bad pain. I had a ton of cells die in my throat through the process of necrosis, through bacteria killing cells. But it didn't kill me. My body eventually overcame that, killed the bacteria, and my body created new cells to line my esophagus, and I can speak again, and I don't have a sore throat anymore. But that's the process of lysis. Through necrosis, that's an abnormal or pathological cell death. When you do chemotherapy, this is what's taking place. So chemotherapy is causing lysis and necrosis. So even if the chemotherapy only killed the cancer cells, you still would get sick from chemotherapy. Because when the chemotherapy kills the cancer cells, all these dead particles, because the cancer cells basically exploding, that's causing all these particles from that cell to be dispersed into the tissue that's picked up by the lymph, that's dumped into the blood, that's causing an overwhelm of the liver, and you feel sick. So this necrosis or lysis of a cell, this pathological death of a cell, because of a strong drug given to the patient called chemotherapy that is a poison, hopefully only uptaken by cancer cells, but we know that's not necessarily true, is killing those cells. Well, we wanted to kill the cancer cells. I don't mind being sick from the cancer cells dying, and honestly, I don't mind my patients being sick from the cancer cells dying. Hey, we could overcome that sickness. But the problem is the cancer cells are not the only thing that is killed through necrosis or lysis when we take a strong poison like chemo. What this doctor is saying, we should take an antioxidant to protect the healthy cells. Well, I see one ginormous problem with that. So now we have to understand the difference between oxidation in my cell, pro-oxidants, and antioxidants. Well, shouldn't I always be taking a ton of antioxidants? Wouldn't that be good for me? Yes and no. So we need this struggle between pro-oxidation and antioxidation. We need to have a struggle here. This is the balance in life. Remember, I've said numerous times that there isn't anything that goes on in your body that is necessarily all bad, and there isn't anything that goes on in your body that's necessarily all good. It's about a balance. You have oxidating processes that take place inside your cells, and then those are balanced out by antioxidating processes that are taking place inside the cell, so that you don't ever have too much of this nor too much of this. Because you need some oxidation that goes on inside the cell, and you need antioxidation that goes on inside the cell. Now, chemotherapy is a pro-oxidant. That's what makes it a poison, and that's what makes it effective against a cell. So pro-oxidants are going to kill cells. So let me show you this slide. So for those of you that we've done your genetics already, you may have seen this. If you haven't watched any of my genetic videos, I'd suggest you do so because I go over this ad nauseum. This here is your transsulfuration pathway. The purpose of this pathway is numerous, but one of the major purposes of this pathway is to make glutathione, which is a cellular antioxidant that works inside the cell as an antioxidant. So here's the detox pathways right here that are making these antioxidants in a person's cells. If I have defects along any of these genes, that's why we need to look at these genes, we're not going to make a lot of glutathione. We're not going to get rid of oxidants. So what are the major oxidants that are in our body? They are what are called free radical or reactive oxygen species and reactive nitrogen species. So ROS and RNS. So these reactive oxygen and reactive nitrogen species, or these free radicals, damage cells, and they can cause what? lysis or necrosis. They can cause cancer. Well, we don't want those. We want to get rid of those then. Well, that is true. But in the wisdom of your body, you actually make some oxidant species. You make superoxide ion and you make peroxynitrite. What's the purpose of that? It's so dangerous. Why would we make that? Why is infinite wisdom created that we actually create superoxide and peroxynitrite in our body? Because it actually has a purpose too. So superoxide and peroxynitrate are free radicals. That means they have an extra electron open on their on the compound. So they will attach, they are attracted to attach to things. If they attach, if we have excess amounts of them, they can attach to our cells and they can damage our cells and they can cause heart disease, they can cause cancer, they can cause all sorts of bad things because they cause oxidative damage, cell and tissue damage, and we can get cancer and all sorts of diseases from it. But we make it. Why would we make it? Because they also can attach to bacteria and viruses and things that are in our body constantly to keep the balance of those things down. So we don't want to have none of these, but we don't want to have excess these. It's about balance. So how do we know we have too many of these? Well, we could discern if I have a disease that is caused by oxidative stress, pretty good chance I might. Well, what are those? Heart disease, coronary artery disease, arteriosclerosis, cancer. We could go on. Do I have those diseases? Well, we should probably check. Do we have high amounts of this? Well, one other way to check is let's look at your genes. If I have a bunch of defects on this gene right here, the SOD gene, this SOD gene makes superoxide dismutase. It makes superoxide dismutase for the purpose of getting rid of superoxide and peroxynitrite. Question came in, how does ozone therapy get oxygen to the area of the cancer and cause the cancer to not grow or to thrive? Good question, but this is not oxygen here. So this is O2 negative. So there's actually a missing little negative sign there. So this is an O2. Apologize for that. Whoever did this graphic missed the little negative sign there. And this is ONOO, abbreviated ONO, but it's actually called peroxynitrite. And this is actually a free radical also. So adding oxygen to your tissue helps decrease these because it will attach to these too. So increasing oxygenation of your tissue helps right here as well. So if I go out and exercise, I'm increasing my oxygenation. It's going to decrease free radical formation. If I'm going in a hyperbaric chamber or I'm going to use ozone, that can help donate an oxygen and get rid of this. That can help with this. But your body, so you're doing that exogenously. You're trying to add a therapy to help do that. But normally within the cell, this superoxide dismutase gene is making superoxide dismutase to grab onto superoxide and turn it into hydrogen peroxide, and then glutathione and catalase through these genes, through these pathways, get rid of hydrogen peroxide, turn it into water, and you pee it into the toilet. So this is all about the balance here, pro-oxidants, antioxidants. So normally, let's say I'm not doing chemotherapy right now, normally, what can cause an increase in the pro-oxidants and an increase in cancer? Defects on this pathway. Defects on this pathway right here. Defects on this pathway. So we look at these genes to go, oh, wow, you don't have any defects here, you don't have any defects here, no defects here, that's great. So are there other reasons why a person would have a lot of pro-oxidants? Sure, a really crappy diet. So what we talked about last week, eating a lot of sugars, causing a lot of excess free radical formation. being around, going and getting radiation, going and getting, okay, should I get x-rays? Yeah, you could get some x-rays, cervical and spinal x-rays, a few x-rays aren't going to hurt you. But if I'm going to getting a lot of CT scans, one abdominal CT scan is equivalent to about 50 x-rays. Well, I had 4 of them this last year. That's 200 x-rays. That's going to cause a lot of free radical damage. It's going to increase the production of free radicals. You better have really healthy SOD and glutathione pathways and catalase pathways to get rid of them. So there's different things. I'm exposed to pollutants. I'm smoking cigarettes. I'm, whatever it is that you're exposed to that increases oxidation, increases reactive oxygen species, increases oxidative stress, that my antioxidant system here can't keep up with. Okay, you're boring me to death, Dr. Connors. Get to the point. Well, the point is when you're doing chemotherapy, you are purposefully adding oxidants to the body for the whole purpose of causing this to the cancer cell. I know we have to kill these cancer cells. Let's poison them. Good idea. How are we going to prevent the other cells from being poisoned? Well, this doctor said we should take a whole bunch of antioxidants, a whole bunch of things that will help promote this pathway. Well, should we? No, I don't think so. Maybe 48 hours after you do the chemotherapy, I would do that. I would not take a whole bunch of antioxidants prior to the chemotherapy, the day before, the day of, the day after. I would wait at least 48 hours after the chemotherapy, because if you're going to subject your body to chemotherapy, you want this to take place to cancer cells. If you are going to add antioxidants, you are not only going to protect healthy cells, you are going to protect cancer cells. So you don't want to hyperload on antioxidants prior to chemotherapy. You want to, if you're going to take chemotherapy, you want the chemotherapy to work. Then after 48 hours, then you hyperload on everything else that we have you going. That's why follow that sheet that we have that I created as a resource for you, for those who are doing chemotherapy, in our blog posts. You guys should be looking at our blog posts. So under our resources page, there is a blog that I created for, it's a sheet to do if you're doing chemotherapy, follow these things. So it does not say hyperload on antioxidants, so don't do that, because you want the chemotherapy to work. Yes, is it going to cause necrosis of healthy cells? Yeah, that's the bad thing about chemotherapy. There's nothing you can do about that. But you can stop the progression of it, because chemotherapy is going to kill the cancer cell really within the first 48 hours. After that, we want to load up on antioxidants, detox the body, do your foot baths, cleanse the body of that chemotherapy so it can decrease the effect on healthy cells. And that's the whole idea of fasting the day before and the day of the chemotherapy too, because that gives healthy cells protection. It does not give the cancer cells protection, and that's been proven. Okay, bored you guys all to death. Any questions now? I am going to open it up. Open up your, where do we go here? I'm going to unmute everybody. Here we go. All right, any questions?
Dr. Connors, I have one. My cancer was a breast cancer generated by a hormone effect. Anyway, I went through menopause and everything and got rid of all the estrogens. Now I'm periodically experiencing hot flashes. Does that equate to, like, if you could be overexposed to bad estrogens in the air pollution stuff?
No, so hot flashes are actually so normally during the life of a female, the majority of her estrogen, I'm going to mute everybody while I answer this. So the majority of your estrogen, I mean 95% of your estrogen and progesterone is produced by your ovaries. And then when a woman goes through menopause, the ovaries start to go through normal programmed cell death, the function of the ovaries. So you're not producing as much estrogen. Slowly, you're producing less and less and less estrogen and progesterone. Now, normally, if a woman has very healthy adrenal glands, the adrenal glands will make up for that loss of estrogen and progesterone. They will never produce as much estrogen and progesterone as the ovaries did, but they'll produce enough so that the woman doesn't have the menopause symptoms. Everybody on this call has known a woman that's gone through menopause that didn't have any symptoms at all. And my gosh, I went through menopause. Great, I don't have my period anymore. Best thing happened in my life. And in 3 other women they know who I went through menopause. I'm still going through it. I hate it. I have to feel like I want to jump in the freezer sometimes. I feel sick. I don't feel good. That's the difference between somebody who's got really healthy adrenal glands and somebody who, to the degree and extent of their symptoms, has less healthy adrenal glands. Now, I will say, if you did any therapy to produce an early menopause, meaning specific aromatase inhibitors or specific things that shut down your ovary production in an unnatural way, which everybody with breast cancer has been at least pushed, that's been pushed on them, then it's almost impossible for your adrenals to make that up that quickly because it's not a natural process. But it is not abnormal going through what women have gone through with breast cancer to have those hot flashes and such. Now you can use some herbs like dung quai and maca root. We have a product called Estrovite that literally I've had women say, if you stop carrying that, I'm going to kill you. I take that very serious when a woman tells me that, so we make sure we carry that product. That saved a lot of women going through menopause and going through hot flashes and symptoms of menopause. So you can use products like that that can just help balance your adrenals and help the production of a natural balance of loss of estrogen and progesterone.
Okay, if you get exposed to, say, like the yard chemicals and farm chemicals that are going all around, you have an overload of false estrogens in your body, could that stimulate your cells to say, hey, there's more here? Do we develop more sites to let it in ourselves because our body's telling us we need it because our blood's saturated with it?
Okay, I'm going to mute everybody and I'll answer that. So, is the exposure to exogenous estrogens, does that stimulate our body to, if I understand the question correctly, that telling our body that we need it, does it stimulate estrogen in our body? Yes, it does. So exogenous estrogens can be a problem, and one could argue that that is a piece of just about every hormonally driven cancer. One could argue that all the exogenous estrogens and hormone disruptors, from plastics to pesticides, you can't go anywhere without being exposed to chemicals that are hormone disruptors. And the increase of breast cancer, prostate cancer, ovarian cancer, and uterine cancer has gone through the roof. Now, that doesn't explain the reason why other cancers have gone up that aren't hormone driven, but it can, I believe it's not necessarily the primary cause, but it is certainly a contributor to those. And does ongoing exposure to that cause a problem with somebody who has already went through menopause or gone through a process of diminishing their hormones? Of course it does. That's why you would continue to use products like DIM to help pull bad estrogens out of your body. Because you're going to be exposed to them no matter what. My saying with estrogens are, you can run, but you can't hide. They're everywhere. They're in our drinking water. You're using plastics. You're exposed to pesticides. You're exposed to farm sprays. It's everywhere.
You know, I have one more, I'll leave this alone, one more question. You don't have me on DIM. Did I not test needing it? Because,
I don't think you tested needing it. So DIM isn't the only product. So the Bronco Protect, the Bronco Linate, those products are really good for that. The Aroma 8 are good for that. So there's other things that help balance the hormones. I don't remember what I have you on, Deb. I have to look at it. But
none of that you mentioned, but okay.
all
Well,
right,
maybe,
I'll have to look. We'll have to revisit the chart.
okay, thank you.
Dr.
Dr.
Connor,
Connor,
go ahead.
Liz Schaffner, how often after 48 hours when you're on chemo can I do foot baths, and should it be the ProWave frequency 1 or 2 or rotate them?
So I would do foot baths. If I'm doing chemo, I would do foot baths daily after the 48 hours. Make sure that you are not getting deficient in your minerals. Make sure you're taking a mineral supplement, and then you'll be safe. But I would do them daily, and I would do I'd rotate some of the detox. I wouldn't do the cancer program on the ProWave. I would do like accelerated detox. The
Okay.
detox, the Clear Line detox program.
Thank you. Thank you.
Dr. Connors,
Yes.
this is pertains to me, and I apologize to the rest of the group, but my husband won't let me back on the tractor until you tell me that baking is not could not damage the tumor. You know, if the ground's hard, and he just thinks that that might be some of my issues.
Oh, that's a very good question. So and that could be, you could liken that for every tumor. Could physical vibration cause the tumor to grow? Boy, we could have a game with that one, because you could make an argument both ways. So if there's if there's a lot of bouncing, like going down a gravel road, or you're on a tractor bouncing in a field, you think there could be an increase in tissue disruption and damage, which then an opportunistic disease like cancer could give way for more growth. I could make an argument that way. The way I could make an argument the other way would be, boy, if there's a lot of movement and physical motion, could that cause more lymphatic movement? Yeah, I guess I could make an argument that way. I guess I honestly would fall on the side of your husband, that more physical motion and bouncing and damage would probably do more harm than good.
Okay.
Especially if it's you're not bracing for it in a way like you're bouncing on a tramp. Well, bouncing on a tramp, that's physical motion. Yeah, but it's consistent, it's smooth, it's a different motion than bouncing in a car, hitting bumps, and bouncing on a tractor and hitting bumps, and that's bringing more angst and stress, I would say.
Okay.
I guess I would fall. I guess I would fall on the side of your husband's thought there.
All right. Thank you. Not what I wanted to hear, but thanks.
I have a tendency to tell people not what they want to hear sometimes.
I have one more question to ask you. Well, actually, two. Michelle suggested the Ion Pro foot baths. We actually have an Ionize Me foot bath. It would not hook to Rife, but is that okay?
Okay, so good question. So there's two different types of foot baths out there on the market. The patient just asked this question this morning. So there's the ionizing foot baths. Those are like the ion cleanse. We have one of those in our office. That's a professional model. I don't know the model that you have, but those are Those are products that have a metal plate that goes in the water. You put your feet in the water, and it ionizes the water, meaning that it's stimulating the water to produce positive ions and then negative ions. And you can set it if you want to run all positive because your toxin that you know that you have is a negative ion, or vice versa. But the one that we usually have it set at 50-50 or something like that. So it's running, it's ionizing the water at positive, then it's ionizing the water at negative, and it will pull out the opposite ion. So when the water is ionized at positive, it's going to pull out negative ions out of your body. And toxins have a charge to them. So it can pull out that's opposite charged toxin. So that's how that machine works. The ion pro wave that comes with the Rife is not ionizing the water per se. It's putting frequencies through the water. Now, does it help still pull out toxins? Yes, it does. Is it as good as one of the Ion Pro or the Ion Cleanse products, the ionization products at like pulling out heavy metals? No, I don't think it is. That's where I think the Ion Cleanse shines at pulling out heavy metals and pesticides and chemotherapy, but the products are not they're not inexpensive. So a good ion cleanse can cost you $3,000 for a professional model. So the Ion Pro Wave, I think, does a very adequate job. Now, what you're saying is you have one of the Ion Cleanse type products. I would say absolutely use it. They could be better in different applications. So the Ion Pro Wave shines even more when you're like trying to pull out Epstein-Barr, you're trying to kill Lyme, you're trying to kill a biotoxin. That's when the Ion Pro Wave from the Rife shines even better. So they are different tools, even though you're sticking your feet in water and putting the thing in there and running a program, and the water might turn different colors because it's pulling some stuff out of your body. But understand the way it goes about it is really two completely different physical processes.
Thanks.
Why would we ever want to take positive ions out of our body?
So positive ions, don't think of them as positive as they're all positive and they say nice things to you all day long. They have a positive charge. So ions have, the definition of an ion is it's either has a negative charge or a positive charge. There's a lot of heavy metal toxins that have a positive charge. So it, so that is not acting at, that can still be a free radical. So
I guess
so
I was middle. I was on it, but not.
Okay, now.
Now.
does that help? We're getting a lot of feedback there.
There we go.
What's the risk that we'll be pulling if you're doing both negative and positive? Then how do you stop from pulling out good positive things and good negative things?
Yeah.
You don't. That's the negative. That's the bad thing, I should say. And what is the good positive or good negative that you would pull out? Minerals. That's all it is.
Oh, okay.
So you will, when you do the ion cleanse, you will pull out minerals. But when you sweat, you're going to sweat out minerals too. So it's like, okay, well, take another shot of greens or something, or take a mineral capsule. It's not a big deal. So it's the benefit strongly outweighs the negative, because all you're losing is mineral. That would be the only bad thing.
Okay.
What is this? I don't know this word.
Dr. Connors, I have another question.
Uh-huh.
My hands look like I am on Coumadin. I have so many really dark purple blotches. And does this mean I'm detoxing too much, or the detoxing is working?
No, could you take a picture of your hands and send it to me?
Yep.
Because that could mean a lot of different things. So if your hands are getting blotchy, like you got bruises.
No, this just looks like you know, someone who has been on Coumadin and like they have those purple spots.
Okay, so you have purple like broken blood vessel type things?
I guess it could look like that. I've gotten them on and off before, but just about in the last week, I'm getting them. They go away in about 2 days, and then they're just a lot bigger. They're about like, bigger than a pencil eraser size now.
Okay. Well, that could be from a capillary fragility. So when a person's on Coumadin, they're on a blood thinner, right? So then their blood clotting mechanism isn't as effective, so they bruise really easy. Their blood vessels, their small capillaries break quite easily. Normally, your small capillaries are breaking quite easily anyhow, but you have enough platelet content and healthy enough blood that you don't bruise because it seals that capillary up and you don't have any problems with it. But if you're on a blood thinner, then it leaks and you end up with bruises on your hands and on your arms and such. So that's not a good condition if you're not on Coumadin to have. That could be low platelet counts. That's the first thing I would think of. Second thing is, well, are you taking tons and tons of natural blood thinners? Are you on a high dose garlic regimen? Are you on people that are doing intravenous vitamin C that can happen too? But I don't think you're doing either one of those two things.
Nope.
So send me a picture and I'll take a look at it and we'll talk.
Okay. All right.
Dr. Connor.
Yes.
This is Jane. Delaney. I'm the one to ask about the therapy, and I was just wondering if you could expound on that as far as just knowing that it actually is getting to the area of cancer. I mean, how do you know that it's actually good?
Okay. Can you type that into the chat? Because I'm getting a reverberation from you and I can't understand exactly what you're saying.
Okay.
I'm going to mute everybody for a second because we were getting a reverberation on Jane's phone. And if Jane, if you could just mute your phone, that would be good. Another question came in over the chat while we're doing this. What type of foot bath is best to do after chemo? Well, that could be disputed too. So the Ion Pro Wave is the Rife one. So the Rife foot bath, there could be really good benefits of that. Running the detox accelerator, the detox program with that could be real beneficial. We've used the Ion Cleanse in our office with that, and we've gotten like, after people do chemo, we've gotten literally, it looks like phosphorescent color from the chemo coming out. So the best scenario would be to do both if you had them both, but do what you can. If you could get to a clinic that has an the ionizing foot bath, then I would get to a clinic and do that maybe a couple times a week, as well as doing your Ion Pro Wave at home. So there's benefits to both of them. And Jane, I don't see your, there it is. I just started ozone therapy and I wanted to know about how it is actually getting to the cancer cells. Okay, so, well, there isn't any guarantee that it's getting to the cancer cells. So if you're doing ozone therapy, so ozone is O3, and the benefit of that is that it will freely donate an oxygen to the tissue, and it can donate an oxygen to free radicals, O2 negative, to basically get rid of them, and so it acts as an antioxidant agent. O3 can also attach to bacteria, so it can be really beneficial for those with Lyme and those with mold issues. So ozone, I think, even shines better with that. Is it getting to the cancer? We don't know that it's getting to the cancer. There's no way to know that it's getting to the cancer. There are some clinicians that believe in injecting ozone right into the cancer. We have done that with one of my doctors here that comes and helps us at the clinic sometimes, who is an emergency ER doctor here, with very, very mixed success. So I'm not convinced that there's benefit to that, though the quote-unquote study we've done has been a pretty small sample size. So question ties into the next question that just came across the chat, which is, do you have zinc shots yet? We have been doing that with ozone with patients and separate from ozone with patients. And we don't have a big enough sample size to know if it is working or not. The success or lack thereof that we've had with patients so far makes me very discouraged whether that's going to be as beneficial as we hoped. But it's just like with anything, you know, curcumin is fantastic for cancer patients, but it's really only going to be fantastic for maybe 20% of cancer patients. So that's where it's difficult. The more people that we have doing something like that, that gives us a bigger sample size in our study, whether this is going to be beneficial or not. So I'm going to unmute everybody again, and we have time for maybe one more question because I have another appointment in just a couple minutes.
Dr. Connors, this is Deb Swartz again. The ozone, what about IV ozone that you drip?
Yeah, but that still doesn't mean that it's getting to the cancer. So.
And you haven't seen any good. Okay, good enough. Thank you.
Okay. Dr. Connors.
Yes.
This is Liz. After 48 hours after chemo, daily foot baths.
Yeah, I would say
I get
so.
chemo every 21 days.
Yep, so then I would stop it the day before the chemo again.
When I fast.
So the day before your next chemo, I would stop.
Good.
And then wait for 48 hours after administration of the chemo. So that's 2 full days. So you've really stopped for 3 full days.
The fasting made a huge, huge difference.
Oh, that's
it worked.
Really good news. Really,
I was not even told that by anyone. It was fabulous information. Thank you so much.
Yeah, I know an oncologist who tries to do things more natural down in Southern California, who's working with the University of Southern California, who's trying to do that with all her patients, and she just absolutely swears it makes a difference on everybody, like cutting their symptoms.
It did for me. Huge. Yeah.
Well,
and
good
no
news.
nausea, vomiting.
Well, that's really good news. All right, well, we're going to have to call it for today, and we'll get this up on Facebook if you want to listen to it again, or if you have questions regarding anything, make sure you get back to me. Bye-bye, everybody.
Thank you.
Bye.
Thank you.
You have a great weekend.
Thank you much.
Thank you.